Question of the day: how do we address a recoupment? Where do we start? Anyone else want to cry when they hear the word recoupment? The reality is that many therapists, at the very thought of a recoupment request, also known as a clawback, they're reminded of why they chose to remain private pay. So I first want to say that if you're private pay, but you accept payment as a out-of-network provider directly from the insurance company, you're also subject to recoupment requests. So don't just accept the request. Let's talk about how we have successfully won 90% of recoupment requests that we've received. We want to learn how to advocate for ourselves as we navigate this process. Before we get too far into the discussion, I want to thank our partners at TherapyNotes for sponsoring this question and answer series. You all know how much I love TherapyNotes, its seamlessness, how intuitive it is, how user-friendly it is. I also love that they have live customer support 7 days a week. So go ahead and try TherapyNotes for free for 3 months by going to therapynotes.com, use our community code MIMH, and get started. So let's go ahead and talk about this recoupment discussion. So recoupment is essentially the process of requesting to pay back money that's previously been paid. It's also known as a clawback. I wrote about this in a blog on the Mastering Insurance site, so go ahead and check that out. We give a little bit more details, including case laws and how to appeal a recoupment request. So for starters, when you get a recoupment request, never ignore it. Review the request, identify who's requesting the recoupment, and what the reason is they're using to justify the request. For example, the recoupment request could come directly from the insurance company or from the third-party administrator. Now that the recoupment request has been validated, meaning it's coming from an organization from which you've been paid, we want to explore why they think you owe them money. Some common reasons are services were paid after termination occurred, it follows an audit that says you didn't meet medical necessity, or they paid a claim they don't believe that they should have paid. Now that we understand the reasons that they think a recoupment is owed, you want to determine who actually breached the contract. In the example of services were paid after the policy terminated, the breach of contract actually occurred between the policyholder and the insurance company. You could appeal on the terms that you provided the services based on verifying that the client had active coverage using the insurance company's site. You performed the service pursuant to the contract and acted in good faith. Therefore, there's case law that supports this appeal being a valid reason. Again, I go through this in more detail in the blog that I mentioned earlier. In the second scenario, where the reason is that it was deemed that medical necessity was not met or not adequately documented. In this instance, the breach of contract occurred due to a failure to properly document the necessity of the services in accordance with the contract terms. It doesn't mean that you can't appeal this decision, but it does mean that the likelihood that you'll win the appeal, not very likely. The last scenario indicates that the insurance company paid and they claimed that they probably should not have. This happens for a variety of reasons. I commonly see this happen when a client has more than one insurance plan and doesn't coordinate their benefits. Again, who breached the contract? Does your paperwork ask about primary and secondary insurance? Does it include a statement that indicates that all insurance policies with mental health benefits must be disclosed? So technically the client breached the contract. However, it's common that the therapist recoups from the client before they reimburse the insurance company. It's important to file an appeal as soon as possible. It will stop the recoupment process and give you time to advocate and identify the resources needed to support why you are not contractually obligated to repay those funds. Lastly, always check the statute of limitations on clawbacks in your state. If the statute of limitations is 2 years and the insurance company is asking about claims that are outside of that time frame, they're not only breaching your contract, but they're violating your state laws. This makes an easy appeal in your advantage. Again, a quick reminder, I did not finish law school, so please make sure you consult with an attorney in your state who did. So that was a lot. I hope you head over to the blog at masteringinsurance.com and check out the recoupment blog that I've referenced. It goes into a bit more details about how you respond and how do you use specific case law that I've referenced in your appeal. Again, don't forget to follow up in the Facebook group, Instagram, and join our Facebook community. Until next time, take good care.